Hi, my name is Max Jordan, and I'm the lead author on the study. And in this video, I just wanted to explain a little bit about what we did, the background and the methods, go over the manipulation, the pressure pain threshold testing, and also kind of go over the results real quickly. So in our study, we wanted to assess the effects of multiple spinal manipulations on pressure pain threshold, both locally and distally. In order to do that, we had three groups. We had a cervical manipulation first group. They received first a cervical manipulation, then a lumbar manipulation. We had a lumbar manipulation group that first received a lumbar manipulation, then a cervical manipulation. And we had a third group that served as our control group. They received a minute rest at each intervention spot. So baseline and after each intervention, each group received pressure pain threshold testing. This pressure pain threshold testing was taken at the bilateral upper trapezius, the bilateral lateral epicondyles, the bilateral lumbar paraspinals at about the L4 level, and then the tibialis anterior muscle bilaterally. So as a quick example, I'm going to show you how we did the tibialis anterior. So this is my patient. If you wouldn't mind, just go ahead and lay down on your back, please. All right, so for each location, we explain to the patient the basic procedure. So I'm going to take this algometer, and I'm just going to press it into the muscle belly, and I want you to say stop when the sensation goes from pressure to unpleasant pain, okay? So I know you can tolerate more, and I'm not interested in how much you can tolerate, but I just want to know when the pressure force changes to unpleasant pain. Okay? All right, so for the tibialis anterior, we came here to about mid-belly. We took the instrument and we applied it at a rate of approximately 5 newtons per second. So you ready? Mm-hmm. Stop. Okay. As soon as the participant said stop, the person who took the measurement showed it to another individual so that they would remain blinded to the measure. And then that was repeated on both sides and in the aforementioned locations. So for the interventions, we did a cervical manipulation and a lumbar manipulation. For the cervical manipulation, we had the participant lay flat on their back. We took them into a separate room so that everybody would remain blinded to the intervention used. And then we used a rotary technique for the manipulation. So after appropriate screening, we had the patient supine. We took the lateral aspect of the middle phalanx and we put it on the articular process of the C4, C5 vertebra. The thumb went near the zygoma, and then with the support hand, we were holding the base of the occiput and a little bit lateral as well. The patient was then taken into a little bit of lateral flexion, some relative extension, and then a quick, high-velocity, low-amplitude thrust in the contralateral direction, in the direction of the zygoma. So here, right there. Okay. That was repeated bilaterally. If no cavitation was produced, then we had a second attempt. But no attempts were made if no cavitation was produced on the second attempt. For the lumbar, we had a sideline rotary manipulation, so if you wouldn't mind laying on your left side, please. We have the participant scoot towards the edge of the plinth. And then from this point on, the participant was asked to remain as absolute still as possible and just completely relax. The knees were flexed, the top leg was brought into the popliteal fossa of the bottom leg. The arm closest to the plinth was pulled so that we can get some relative trunk rotation. The other arm was allowed to remain at the side. The hypothenar eminence was brought at about the L4, L5 region. The patient's mass was brought underneath, and then a quick thrust was applied. Again, if a cavitation was produced, it was then done on the other side. If no cavitation was produced, there was one more attempt made. Thank you. So the results of our study found that regardless if we did a cervical manipulation, a lumbar manipulation, or no manipulation at all, there was no immediate change in the pressure pain thresholds, either in the same segmental area or distally. And this was on a healthy, asymptomatic population. Thank you so much. Have a good one.